Okay, 7:30. Are we ready? Donna, are you there? Did you get to your office, wherever you are?
Yes, I did, Madam Chair, and we are now live on YouTube.
Okay, awesome. If you will call the roll, please.
Okay, Representative Clifford,
Here.
Connolly,
Here.
Flitner,
Here.
Hallinan,
Walking in the door.
He's here. Shout here, Representative Hallinan.
Hallinan, that's an Irish name. Isn't it?
Representative Ottman,
Here.
Representative Martinez,
Here.
Representative Stivar,
Present.
Representative Worf,
Here.
Madam Chair Wilson.
Here.
All right, we have 9 present, Madam
Thank you
Chair.
very much. Thank you, Donna. Thanks to all who came in through the snow, or if you slept in the Capitol for several days, whatever your situation was. Happy St. Patrick's Day to all of you wearing green and whatnot. Okay. I'm going to give a little explanation of what my plan is. Hopefully the plan will survive the morning. We are going to hear 4 bills. We will have the sponsors will be able to present the bill, and we will take public testimony on the bills. Then we are going to meet upon adjournment later today, late afternoon, whatever the timing ends up to be, to work the bills. So we will have questions from the committee as they wish to the sponsors and the witnesses, but just keeping in mind that we need to be in the chamber by 10. So I have a request of people who want to testify on the bills. The 4 bills are really quite different in what they're attempting to do. You know, all of us here on the committee are of a certain age at least, and generally understand the topic of abortion. So we don't need to hear general comments about right to choose or right to life, because I think we are aware of those issues, and it will be much more useful for people to testify on specific issues in each bill. So what I'm planning to do first is, because we have so many, and actually, if you're planning to testify on this bill and you're out in the audience, would you just raise your hand? Any of the bills? 1, 2, 3. Only 3. Okay. So, and I must say, it's really difficult to look at the back row through multiple layers of plexiglass. It's sort of like, you can put your hands down now.
No,
Oh.
FYI, I haven't seen a problem as well, so I may slip out, but.
That's fine. So what I'm going to do, because we do have 30 some folks online, I'm going to ask Donna, who is our LSO staffer. And by the way, you'll notice we have no committee secretary today. So our name tags are not up. We're kind of short on pencils and that sort of thing. So you'll bear with us. I am going to ask Donna to ask those who are online I will go through each bill by name and ask just for a show of hands online, how many in favor, how many opposed, and then putting those hands down, how many of either opinion will actually want to testify. And I'll do that for each of the 4. Basically, we have 2 hours, given that everything always runs a little slushy in time. And that way I'll know roughly how many minutes we can fairly allot to each person. You know, plainly, a person could testify on every bill, but just be cognizant of if you do that, you're reducing the amount of time for everybody. And I am planning to close all the testimony on all the bills so that we can be up in the chamber by 10. Let's see, I think that's pretty much it. So Donna, if you would just inquire online regarding House Bill 253, the UW ban, if the people who are online would raise their hands if they are in favor, not if they want to testify or not, just if they are in favor. And tell me how many.
Just a minute. I'm giving everybody a chance to raise their hand.
You have to
Just a
find their
moment,
hand.
please.
We know how that is.
Madam Chair,
Yes.
for House Bill 253, I have 14 hands up, indicating, yes, they support the bill.
Okay. Donna, Representative Gray just said he received an email from somebody or a text that the Zoom link that you previously had sent out had expired. So I'm not sure how 14 people can vote if the Zoom link has expired, but maybe, maybe when we're talking, you might investigate that. Could you ask,
Okay,
please
I
put those
will
hands
look
down and
into
ask
that.
how many people are against House Bill 253?
Okay, sorry, if you would wait a second while I need to lower everyone's hands. So
Okay.
people in the Zoom, please wait till I lower all hands. Okay, now people on the Zoom, please raise your hand. This is for being against House Bill 253, is that correct, Madam Chair?
That's right.
Okay. I'll give everyone a moment to raise their hands if they're against House Bill 253. Madam Chair, I have 5 hands up.
Okay, thank you. And then while you put those hands down, then the next question would be, how many of any of those 14 or 5 want to testify on that bill?
Okay, if you would like to testify on House Bill 253, please raise your hand on the Zoom webinar. Madam Chair, I have 9 hands up.
Okay, very good. Thank you. 9 to testify. Then on House Bill 161, the discrimination bill, could you ask, please, how many are in favor?
Okay, if you are in favor of House Bill 161, please raise your hand on the Zoom webinar. Madam Chair, I have 15 hands up.
Okay, and then how many, putting those hands down and finding out how many people are there against?
Okay. If you are against House Bill 161, please raise your hand on the Zoom. Madam Chair, I have 6 hands up.
Okay, and then putting those down, how many people wish to testify? And committee, while she's doing that, I'm just asking these things because when we have a room full of people, you know, a lot of times we'll say how many for, how many, just so we can kind of get a sense of if we have to limit testimony, how we want to arrange that. So I just figure, seeing as you can't actually see the people, I will inquire.
Okay. Madam Chair, I have 6 hands up of people requesting to testify on House Bill 161.
Okay, and then for House Bill 70, informed consent, how many in
Okay,
favor?
give me a moment to.
Yep, you're doing great.
All right, if you're in favor of House Bill 70, please raise your hand on the Zoom. Madam Chair, I have 19 hands up.
Well, okay, how many opposed?
Okay, give me a chance to lower the hands.
You're doing great.
If you are against House Bill 70, please raise your hand on the Zoom. All right, I have 9 hands up.
Okay, and then how many wish to testify?
Let me lower hands, please, first. All right, please raise your hand if you wish to testify on House Bill 70. Madam Chair, I have 16 hands up.
Okay. And then House Bill 134, the heartbeat.
Okay. If you're in favor of House Bill 134, please raise your hand on the Zoom. Madam Chair, I have 19 hands up.
Okay, and then against?
Okay, I'm gonna lower hands first. If you're opposed to House Bill 134, please raise your hand on the Zoom. Madam Chair, I have 8 hands up.
And how many would like to testify?
The lower hands first. If you would like to testify on House Bill 134, please raise your hand. Madam Chair, I have 15 hands up.
Okay. Okay, so right, but I'm just looking at so we've got basically 2 hours. What I will do is just kind of recalculate after this for each one of the bills after each sponsor presents. Some sponsors may end up being lengthier than others, but I will attempt to do a math problem periodically. If the train leaves Laramie going at 20 miles an hour and another train leaves Cheyenne at 16 miles an hour, when will they meet? That is the math problem. We all remember that from about 8th grade, right? In a snowdrift, that's right. And there is a snowdrift which is stopped by laborers shoveling, and one has lost a shovel. Okay, sorry. All right, I'm just putting up a timer here. I'm not going to time the sponsor, but okay. The first bill for our consideration is House Bill 253. Representative Gray, you're on. Welcome to the Labor Committee.
Thank you, Madam Chairman. Can I go ahead?
You go right ahead.
Appreciate it. Okay, so House Bill 253, this University of Wyoming ban on funding for abortions. Last year, the Wyoming State Legislature passed a budget amendment banning the University of Wyoming from covering abortions in their student plan after it was discovered that they were doing this. Taxpayer funds were subsidizing abortion, and that's wrong. That budget amendment, which did pass, is going to expire, though, with the end of the budget. So we need to codify this. Just as there is a statute for faculty, we need to have a statute for the other situation as well. So that's what this bill does. Going through the bill, page 2, line 11, it's just amended language as a condition of receiving or expending any monies or funds appropriated to the University of Wyoming. University of Wyoming shall not expend any general funds, federal funds, or other funds under its control for elective abortions for students or group health insurance that provides coverage of elective abortions for students. One thing is I do think we should add the community colleges to this. We did not do that in the budget amendment, and I think we should do that here. And that would be one amendment I would request. Thank you.
Okay, questions for Representative Gray. Representative Connolly.
Thank you, Madam Chairman. Representative Gray, can you explain how students get health insurance at the University of Wyoming?
Representative Gray.
Thank you, Madam Chairman. Yeah, we discussed this a little bit on the budget last year. So it is other funds under its control. So I mean that's why we insert that it would include the concept is, and this gets back to the concept of subsidization, where we're doing that state aid in at such large numbers. That's all commingling, and the idea is that it's a condition for them to receive that funding. That we're not going to be subsidizing or funding one part of the university, which allows them to fund this part. So even if the students are funding that out of their own funds, it still means the taxpayer funds are subsidizing abortion, and that's wrong. So that I think is what we're changing here.
Okay.
Follow
Follow.
up. Representative Gray, what's the relationship of state funding to student fees
Representative Gray.
in terms of healthcare for students?
Thank you, Madam Chairman. So it's analogous to as we talked about last year, the Planned Parenthood situation where if federal funds are being used for other parts of Planned Parenthood, that's subsidizing abortion. And that's why that's the defunding argument there. It's the same thing here. When we're bringing in that state aid to the university, and then they're using the student fees for the plan, which is covering abortion, that state aid is subsidizing the abortion. And so it's the abortion's same situation as the Planned Parenthood example, which I also, it's the same situation.
Madam Chair, follow up. I'm very confused. We don't have Planned Parenthood in Wyoming. And so I'm very confused about that as an example. I'm also curious, what about state workers' health insurance?
Representative Gray, although that's not in the bill, but Representative Gray.
Madam Chairman, thank you. It's just an analogy. It's a similar situation that is in the news a lot. It's in the political discourse, and it's the same situation here. When the federal government if they bring hundreds of millions of dollars to Planned Parenthood, even if it's specifically not earmarked for abortion, it's propping up that side of Planned Parenthood, and that's wrong. It's the same thing here. So it's just it's just providing that similar example. There's a statute as well for faculty that's already covered actually in statute that is very specific that cannot be used for abortion. The student situation was that separate situation, and we discovered that was being used, that they were covering in there, and we brought in. I'm happy to bring that here again, and where in their student plan it was very clear they were covering elective abortion. And that was all last year. It's in there. It was page 47 in their certificate of coverage.
One more. Madam Chairman, so would the effect of this bill be that the University of Wyoming might not be able to contract for the best health care for its students as well as the cheapest because of this limitation?
Representative Gray.
Madam Chairman, I would say no there. This is about subsidizing abortion, and that's what we're saying here, and that's wrong to do that. So we're gonna prevent that, and we're gonna put that in statute just as we do that in the budget. We've had that in the budget. That's gonna end here at the end of the budget year. So we codify it, and that's what we're doing in this bill. I've already got this in the budget, but the budget expires. And so the idea here is we put it in statute.
Representative Clifford.
Thank you, Madam Chairman. Representative Gray, I have a concern where we're talking about students and all the contractual agreements that we have with the schools that encompass the University of Wyoming. So let's say, for instance, we have teachers who want to get continuing education, and they have these agreements. It could be dentistry school in our statutes. It could be the UW technology with our extractive industries, and people want to further their education, so they're applying to become a student at the University of Wyoming. So going back to my example of educational teachers, and they're going to apply, they're going to be a student, and their insurance allows them and offers them elective abortions. Wouldn't you agree that's unfair to the UW students as a whole? Is that fair? When they come in as a student, they have a job, they're continuing their education, but their current health insurance allows for elective abortions. Is that fair?
Representative Gray.
Well, Madam Chairman, again, this is about the coverage to the University of Wyoming. So if they're going to attain coverage to the University of Wyoming, which is being propped up through Wyoming state aid, that's taxpayer funds, they're not going to be able to attain have coverage that covers elective abortion. That's what this is saying.
Certainly, if they continued working at their other job while they're taking classes, their, existing insurance would.
Thank you,
would
Madam
continue.
Chair. And my point is just that, the fairness, being a student, getting credit from our only land grant university institution here. I think I would just assume, I don't see no fairness in that. And, I understand it's for that specific, for students to apply for it, but students coming in from other occupations to obtain credit through the University of Wyoming that have insurance that cover this, I just think that's unfair. Thank you.
Okay, any further questions? If not, let's get some questions. Is there anybody in the room who wants to testify on this bill? Raise your hand and come.
Madam Chairman, really quick, I do have minerals. So what I was going to do, when the fourth bill comes up, I was going to come back for that. Is that okay?
That'd be great.
Okay.
We don't have a secretary to call you for minerals?
Yeah, I'm just going to get a text.
Maybe
that-
we can
yeah,
kind of send someone from the room to run over and,
Thank you.
what room are you in?
I think
Is
it's
minerals
one
in?
next door,
One
5.
next door. Okay.
Thank you.
I'm sure we can work this out. It's, we all take on new roles in a blizzard. Thank you, Representative Gray. Okay. Those who wish to testify, we have 15 minutes left of the time allotted for this. And we said we had, here's my paper. Well, you can be first. We have 9 people who want to testify in 15 minutes. That's basically a minute and a half.
Thank you,
Carry
Madam
on.
Chair, members of the committee. Lynn Hutchings, Senator, Senate District 5. Just wanted to say quickly, I spoke on behalf of this particular piece of legislation last year during the budget session in the Senate. So I just wanted to say I am on and for. And if I could maybe address Representative Clifford's question. Thank you, Madam Chair. Representative Clifford, if I heard you right, you were saying that someone came in to the university that had insurance that paid for abortions, and you were thinking that it was not fair that there were students at the university already, my assumption, that had insurance that did not pay for abortions. So you were saying that was unfair. But what we're talking about is state funding, not just any insurance plan. So with that, Madam Chair, there are no other questions. I'll run to my committee.
Well, I told Donna about that 10 minutes ago, so I should. Any questions for Senator Hutchings?
Thank you.
Thank you. Did you just get that, Representative Stivar? Representative Stivar, did you just get that message?
Yes, ma'am.
So it's a repeat of the previous message from 10 minutes ago? Yeah, everybody else seems to be getting in okay, so I'm sorry, I don't have, okay. Online, Donna, who do we have? Was there anybody else in the room that wants to testify? Okay, I'm gonna kind of swap back and forth between online and in the room. Donna, who have we got with their hands up or that wants to testify now on House Bill 253? Send someone in.
Okay, currently I have 6 people with their hands up. Anyone else who would like to testify on House Bill 253 on Zoom, please raise your hand. Oh, now I have 9. Why don't do you want me to send in the first 2?
Sure. And then we'll take one from in the room.
So I have admitted Marty Halverson and Olivia de Lavagier. I know I didn't say that correctly.
Okay.
Is that all right to start testifying?
I'm looking for Marty Halverson. There we go. Representative Halverson, former Representative Halverson, welcome. Thank you. You've got like a minute and 40 seconds.
You got it, Madam Chairman. I respect your time this morning. I am Marty Halverson. I'm here on behalf of Wyoming Right to Life. We ask that you support this bill. Wyoming is a pro-life state, and that should extend to our state institutions. That $1 of taxpayer money would go toward the funding of even one abortion is an anathema to most Wyomingites. Did you know that college students are mostly pro-life? And why shouldn't they be? They grew up seeing the photos of their own ultrasounds and the ultrasounds of their brothers and sisters. They know that that is not a clump of cells. They know that is a living person. They know that is them. Please respect the majority of Wyomingites and support this bill. Thank you, Madam Chairman.
Thank you. Any questions for Ms. Halverson? I don't see any. Thank you very much. Okay, the next person, and could you just say your name for us again, just so that we make sure to understand clearly?
My name is Olivia de la Veaga. I am one of those pro-life college students. I represent about 35 members of our pro-life group here on campus for Wyoming Catholic College. And I would just like to speak in favor of this bill and just point out that this bill doesn't say that students can't have health insurance covering abortions. It's just about whether or not the federal funding will support those plans. And it seems reasonable because if government funding is going towards supporting abortions, then that means that people are forced to support abortions whether or not they believe it's right. And that does not seem to be justice. So I'd just like to say that. Thank you.
Very good. Questions for Ms. De La Vega? No, very good. I must say so far our witnesses are doing very good at 1 minute and 40 seconds. They have excess time. Okay, Donna, I'm going to take a question or a testimony from in the room.
Okay,
welcome.
and I'll admit the next two people just so that they're on board.
Perfect. Welcome. If you'll introduce, you're getting the hang of it now, having watched so many.
Yeah, I watched a lot.
Introduce yourself for the committee, if you would, please.
Myself. So, good evening or good morning, Madam Chair, members of the committee. My name is Jesse Campbell. I'm a UW student, lifelong Wyomingite. I just want to say that I'm very much in support of this bill. I definitely not comfortable, as a student, with any of our student fees or taxpayer dollars going in any way to abortions, whether through healthcare plans or through research on fetal tissue, anything like that. So very much in support of this bill, and hope you guys will consider it favorably. Thank you.
Awesome. Questions for Mr. Campbell? Thank you. Very good. Thanks very much. Well, we're doing really well this morning. Donna, who have we got next? Two more?
I admitted Amy Robaum and Wendy Volk.
All right. Ms. Robaum, welcome. If you'll just, I know you were just introduced, but introduce yourself for the committee and we'll be glad to hear what you have to say.
Hi, my name is Amy Robaum. I'm testifying in opposition to this bill 253. I work as a nurse practitioner at University of Wyoming Student Health Services. A large part of the care I provide to students is family planning and reproductive health care. But I do want to make it clear that I'm testifying today as a private citizen, not as a representative of student health or of the university. However, I think my professional experience is relevant here. Since the passage of the Affordable Care Act, the student insurance now covers access to any form of birth control for free. And as a result, we've seen many more students be able to get on very effective long-term methods of birth control. Unintended pregnancy rates have gone down as a result. But as we all know, not all students use contraception reliably, not all sex is voluntary, and no method is 100% effective. And an unintended pregnancy during college is a significantly impacts the career planning and academic abilities of students. I want to make it very clear that federal funding does not go to pay student fees. Students pay their own fee to be able to access care at student health. It doesn't come from state funds. And the student insurance, most students pay for that out of their own pocket. It has nothing to do with legislative funding. And I can honestly tell you that in the 15 years I've worked at student health, I have seen one single student utilize their student medical insurance to pay for an abortion. One student in 15 years. So I really feel that this bill is unnecessary. Students, make this decision. It's a very difficult decision, but it's not something that they take lightly or that's done all the time. And yet abortion is legal and it should be available to students who need it for them. As with all insurance, you're paying to have access to care you hope you will never need. And making that financial barrier even harder for students just further puts our vulnerable students who don't have resources and finances at increased risk, which impacts their ability to succeed academically and find good jobs and further the mission of the university and of the land grant mission of the state. Thank you.
Thank you. Any questions for Ms. Robum? She did go a little bit over, but we kind of locked up in the middle. So, and I do appreciate, imagine you have patience to see. I think you sent that to your effect, but Representative Connolly.
Yeah, thank you, Madam Chair, and thank you, Ms. Robum. You froze for a second, and so I just wanted to make sure that I got down two things correctly. That you contradicted, honestly, the bringer of the bill in terms of how students get health insurance. I'm curious in terms of payment for it, and I'm curious if you heard that introductory comment, and what were you presenting actually different information, kind of the accurate information about how students do get health insurance at UW?
Ms. Robum?
Yeah, I think some graduate students, their fees, their premiums can be covered by their departments. I don't know what percentage of it is. The undergraduate students, they all pay for the insurance out of their own pocket. And the fees to be seen at student health come entirely from student paid fees.
Okay.
Thank you.
Okay.
Madam Chair, just one other,
Mhm.
and that was in relation to kind of what's effective in terms of preventing unwanted pregnancy. And did you mention long-acting reversible contraceptive? Was that what you mentioned as the better way?
Well, they're the more effective methods. We make available to students any methods: pills, the vaginal ring, the depot shot, but the IUDs and the arm implant are significantly more effective, and they are long-term, so they're more convenient. They typically cost upwards of $1,000, and students would never have had that kind of money before, but now that insurance covers it, many more students are choosing these super effective methods, and as a result, they don't get pregnant.
Okay, thank you.
Very good. Okay, thanks very much. Have a good morning over there. Donna, I think we've got Ms. Volk next.
Morning.
Good morning.
Good morning, Madam Chairman. This is Wendy Volk. I'm speaking from Cheyenne, Wyoming. I am a Republican. I am pro-Wyoming, pro-woman, and pro-choice. And I want to just also say, I am also the mother of a college-age daughter. And one of the things that I think is easily overlooked is that oftentimes our students in college experience some things that you don't want them to experience in college. I have had friends of our family, daughters be raped. And if my daughter was raped at college and then a pregnancy was, a product of that, I would want to be able to know that my daughter would have every choice available to her, especially if it happened at the University of Wyoming by a member of the student body or whatever on college. I think there's these unexpected things that you should not have to send your child to college and then have it's irreversible. And I just don't think there's anything in this piece of legislation that says anything in regards to rape. And I'll close my comments. And I would ask that you would oppose this bill.
Questions for Ms. Volk? Great, thank you very much. Donna, can you let in two more?
Yes, I will. Madam Chair, I've admitted Mike Lehman and Nathan Winters.
Okay. Mike, welcome. If you'll introduce yourself for the committee, please.
Morning, Madam Chairman. I'm Mike Lehman, and I represent the Catholic Diocese of Cheyenne. Just briefly, appreciate the time to testify on this particular bill. We do support it. One of the questions that we always have to sort of deal with here is recognizing, to the extent that this conversation on all of these bills is limited to individual rights and freedoms, we certainly can all come to an agreement on much of this. The challenge is that very often we're not considering every individual in the picture, and certainly respect our healthcare providers and the testimony that's been given this morning. But if we keep the full context, every individual in this picture, what we just heard, that only one particular situation in 15 years happened, if we're recognizing that as a human person, that's not acceptable. And so with that, I'd like to reserve a little more time to testify on the other bills. And so I will stand for questions.
Great. Questions for Deacon Lehman? Okay, thanks very much. And former Representative Winters.
Madam Chairman, it's good to be with you and the committee. And I also want to
Introduce
speak very
yourself.
briefly.
We have new folks here, so introduce yourself. Even though I
Sure.
just know you.
Yeah, sure. My name is Nathan Winters, the Executive Director of the Family Policy Alliance of Wyoming, and I'm going to speak on several of the bills today. So I'll speak very briefly on this, but I'm speaking in favor of House Bill 235. This bill is narrowly tailored to address a specific issue as to whether Wyoming healthcare plans should take part in elective abortions, and it's very clear how narrow this is tailored. Elective abortions for students who are taking part of the group health insurance that provides coverage for elective abortions for students. And I think that narrow tailoring should really address any concerns that some may have who are speaking in favor of abortion. This right here is something that the state government shouldn't be taking part in. And so with that, I'll stand for any questions. Thank you, Mr. Chairman.
Questions for Mr. Winters? No, okay, thank you. Donna, is that all we have for this bill?
Madam Chair, no, I've admitted Christine Lichtenfels, and I have 4 more in the waiting room.
Okay, I'm just going to take in Christine, and I'm sorry, then I'm going to have to stop testimony just so we have room for the other ones. We let in Christine, and those of you who are still in the waiting room, what I'm going to do at the end of testimony on all these 4, if a miracle occurs and the sun stands still and we still have time at the end before we go up to the chamber, then I will open it back up to people who didn't get a chance to talk. Okay.
Ms. Lichtenfels will have to unmute herself and turn on her video.
Thank you. Madam Chair.
Good morning. Introduce yourself for the committee, please.
My name is Christine Lichtenfels. I live in Lander. I'm a graduate of the UW College of Law and a practicing attorney. And I'm speaking in opposition to this bill. I think the fact is that the funding is all from the students. It's inaccurate to say, I mean, Planned Parenthood actually does get federal funding. Systems such as UW and anyone that's got a good accounting system is really quite able to make sure that funds are not commingled. That's a fairly simple accounting task to do. And I would hope that UW is capable of that. I'm sure it is. And so to suggest that these are government funds is inaccurate. And I would hope we wouldn't make a decision on something inaccurate like that. I do believe it's important that it's part of the insurance. We've got our amendment, the healthcare amendment to the Constitution that says that everyone should be able to make their own decisions about their own healthcare, and that includes being able to implement that decision. At this point, really, it's the students' funds. The students are the ones who should be able to make this decision. It's not something for the legislature. And to follow up quickly on Nurse Robom's comments about the students and the future that they're looking at if they're denied an abortion when they're wanting it. And there are studies showing that the outcomes are much worse. A person denied access to an abortion that they want has 4 times greater chance of living below the federal poverty level. They're more likely to experience serious physical complications because actually having a pregnancy is about 14 times more likely to result in death than getting an abortion. They're more likely to stay tethered to abusive partners, and that's really important in the college setting. And they're more likely to suffer anxiety and loss of self-esteem in the short term after being denied an abortion. So for all these reasons, in an effort to provide to provide proper care for students and give them the choice. They're the ones who should be giving the choice. No Wyoming funds will be supporting it. And so there's really no need for this bill. And I guess one other thought that I had was, I don't know the facts on the faculty insurance, but having been an employee in many different situations, my guess is that the UW, the government does actually at least partially underwrite that funding as part of a benefit. And so that's a different situation than the situation where the student funds pay for all of it. Thank you very much. I oppose the bill.
Questions for Ms. Lichtenfeld? Representative Ottman.
Madam
Good.
Chairman and Ms. Lichtenfeld, I was just wanting to verify, you said that the students pay, all the students pay 100% of their own health care. Is that correct?
Ms. Lichtenfeld.
It is my understanding that they pay their insurance, that the funds for their insurance coverage. And that's what's at issue in this bill, is the insurance coverage.
Follow up.
Representative Ottman.
So basically, if they have grants or things like that, none of that goes, they particularly pay for their own insurance out of pocket. It's not part of student support.
Ms. Lichtenfeld.
And I will say, I'm not an expert on that. I will say that is my understanding of the way the system works.
Okay. Further questions for Ms. Lichtenfeld? Okay, then public testimony is closed on this bill unless we, as I say, if we circle back at the end of the morning. The next bill for our consideration is House Bill 161. Representative Romero Martinez, if you'll present from down there, please, so that because we can all see you better from there. Okay, 20 minutes for this one.
Thank you, Madam Chair. I know
Good
we're on a
morning.
tight schedule. Can you give me a minute breakage? How much time do I have?
Yeah, well, we have 20 minutes total for the bill. So if you take 20, that leaves none for anybody else.
Thank you.
No pressure.
Thank you, Madam Chair. This is my first bill. I have a couple I think I know I can use names in committee,
You
right?
can.
Okay,
You may.
So I'm going to start by introducing the bill, House Bill number 161, Human Life Equality, Prohibiting Discriminatory Abortions. An act relating to abortions, prohibiting abortions based on selective reasons and disabilities as specified, providing definitions, providing criminal penalty and disciplinary sanctions for violations, imposing civil liabilities as specified, making conforming amendments, requiring rulemaking, and providing for an effective date. Now I'm just gonna walk through the bill as best I can. In section 1, line 10, we're creating a new section here if the body so chooses. Abortions based on disability and other selective reasons, prohibited penalties. No person shall be intentionally perform or attempt to perform or cause to be performed an abortion if a person knows that the abortion is being sought solely because of the unborn child or human fetus or human embryo has been diagnosed with a disability or has a potential diagnosis or disability, or the unborn child or human fetus or human embryos, sex, race, color, national origin, or ancestry. Going on to page 3,
And Representative Romero Martinez, let me just say that you don't have to, and I appreciate it's your first bill. You don't have to actually read all the words. Just feel free to kind of leap from one highlight to the next.
And this is where I leap to my next highlight.
Okay, very good.
Page 3, line 14, and thank you, Madam Chairwoman. By creating a new subsection here, we're doing amended language here. So in 13-1-118, the health board license provides a board that licenses healthcare providers may refuse to issue or revoke licenses, certificates, or temporary permits. Going down through definition, what we're doing here is we're defining disability as a disease, defect, or disorder, or genetically inherited, including a physical disability, mental disability. I know don't want me to go through all of it, but I know that these are important. Intellectual disability also, physical deformity, scoliosis, and the like. Going on to page 5, you can see here as used in this section, healthcare provider means any individual who is licensed or certified otherwise permitted by law in states to care, treat, or provide services to basically maintain a person's health. So that's just a brief walkthrough. I'm not a doctor, I'm not a nurse, but I have been very close to healthcare my entire life, like all of us who've had mothers who take care of us. I really just want to really just open it up to the people who are about to testify, but I did want to make a couple of comments and asking for favorable consideration from this committee. In recent years, sex selection abortion has drawn increasing attention worldwide. A sex selection abortion is an abortion undertaken to eliminate a child of an undesired sex. Hillary Clinton has expressed opposition to sex selection abortions. In 2009, in an interview, the New York Times, then Secretary Clinton was asked how she would advocate for women in other countries. Secretary Clinton stated that unfortunately with technology, parents are able to use sonograms to determine the sex of their baby and to abort girl children simply because they'd rather have a boy. Sex selection abortions are being performed in the United States, and at least 2 studies, both from the Pro-Abortion Guttmacher Institute, have found evidence that sex selection is being practiced in the United States. For example, researchers conclude that the most logical explanation for the irregularity in boy birth percentages in the United States. I ask for your favorable consideration on this bill, and I'd like to open it up for questions, comments, concerns, and then of course, questions that I can't answer because I'm not a doctor. Thank you, Madam Chair.
Questions for Representative Romero Martinez? Representative Connolly.
Thank you, Madam Chair. Representative Romero Martinez, I think we all agree that choosing children based on characteristics like sex, race, color, national origin, or ancestry is something that we don't want, that we don't as a society want to go down that road, that we would like to believe that those characteristics are irrelevant. But if I didn't have so many other problems with this bill, I'd want to add sexual orientation in there as well, and as an important factor. However, that being said, I had so much trouble with the language in the bill, and I'll ask you about a couple of them. And so how would, for example, on page 2, line 3, a physician, and I assume it's the physician, who would be responsible for determining whether an abortion is being sought solely because of one of these factors? So how is that determined solely?
Representative Romero Martinez.
Thank you, Madam Chairman and Minority Speaker Connolly. I don't know that I know the answer to it, but what I do know is that when a woman goes into, I do know that well, anyone goes in to talk to a doctor, a man or woman, they're gonna ask them what they need. And if they're asking, well, hey, if they are solely doing it for the reason to find out what sex their child is, or what race they are, or whatever, they do a genetic test. They're not just going to find out if it's a boy or a girl. They're also going to find out other genetic information with the new science, how it's evolving. And if they get that information, oh, it's a boy, I don't want it. Oh, it's half Hispanic, I don't want it. If they're doing it solely for that reason, I think that that's the answer, but I would yield to somebody who might know the answer better than I do.
We may have providers testify on that later, I suppose. We're kind of getting a hypothesis there, but did you have a follow-up?
Yeah, Madam Chairman. Yes, and so I'm kind of, and this would be for providers that are out there as well. What are we imagining? A form that we are now going to have physicians fill out in some way so that we can determine whether it's solely or in part or something along those lines. I don't get administratively how this would work. I don't understand then on page 2, line 7, what's a potential diagnosis? That doesn't make sense to me. I don't understand what a potential diagnosis is. And then I'll just give you more. There is the definition of disability on page 4 is unlike any definition of disability that exists in our statutes or exists with the ADA. And so it concerns me greatly that we're putting into statute a definition that exists no place else and uses a language of a lethal fetal anomaly, which again, from my limited research, that definition doesn't exist out there either. And so I'm very curious about your answer regarding these particular terms.
Okay, so just to summarize, so on page 2, line 7, potential diagnosis of a disability. Page 4, the general diagnosis or the general definition of disability, and whether lethal fetal anomaly needs a definition. I mean, possibly it does not. I don't know. Go ahead, Representative Romero Martinez.
Sure. In regards to potential diagnosis or disability, my understanding is that when a child is conceived immediately upon conception, it either has 46 or 47 chromosomes. So 46 in the case of a person without Down syndrome and 47 in the case of one who has Down syndrome. Going through the process of maturation, starting at conception, which we just recently obtained new imaging that we now see a burst of light upon conception, we know that sociologically, scientifically, biologically, that it's a Homo sapiens sapien, so it is a human being, it's a human person. Through that process, it is my understanding that we may have a propensity for, in other words, we can't just tell you everything that's going to go wrong because of the Human Genome Project, but we might have a potential for a disability. And I think that question would be better answered by a medical doctor. But my understanding is some disabilities don't just happen right away. They don't have some disabilities. You might not even be able to know about them until after birth. Some of them maybe even before birth. And then to the second question in regards to no definition, like I worked with national and international leaders to help draft this law. I'm not a lawyer also, so I can't speak as an attorney, but I did also make sure that this bill did go through its 2 reviews through the LSO to make sure that the language conformed within the statutes that we currently have, which I do believe in and of themselves are limited.
Madam Chair.
I was just going to say, Representative Connolly, so I do actually have an amendment for this evening, bringing more ADA-like language into the disability definition, just in answer to that. But did you have a follow-up?
And I need to leave and present a bill over in minerals. And so I just wanted to say that, but I just wasn't walking out on you, Representative Romero Martinez. I'll be back.
And thank you.
That's right. We do not perceive you as huffy. Thank you.
Not huffy.
I can think of a lot of comments about those of us, never mind. I was going to refer to myself, but I better just be quiet. Okay, any more questions for Representative Romero Martinez? No, okay, so let's see. We have 10 minutes left on this time. And we have, Donna, is there anyone in this room who wants to testify in this bill? 2 people, okay.
Madam Chair, I'm sorry, I currently have 6 hands up in the Zoom waiting room.
Okay, very well. Why don't you let in all 6, and Senator Steinmetz, if you want to come up and testify in this bill.
Okay, Madam Chair, correction, I now have 15 hands up in the Zoom waiting room.
Well, let in 4 and we'll see what happens. Let in the first one. Senator Steinmetz.
Good morning,
Welcome.
Madam Chairwoman and committee. It's good to see you today and glad we could all get through the snow and be here together for this important bill. And I trust the committee's good work. You know, when we bring our first bill, sometimes we haven't anticipated quite everything, and we've all been there. So I commend the good sponsor of this bill for his good work and want to tell you how important it is. So a pending diagnosis or a diagnosis, my daughter, I'm the proud grandmother of a grandson with Down syndrome. And there was a test given to him early on, my daughter, when she was pregnant, and she was advised to abort him because he had Down syndrome. And so that's what we're talking about here, that it really brings it to life because he is one of the great joys of my life. And had she listened, he wouldn't be a part of my life. Of course, it was not an option for our family. But his little life is precious and it's valuable, and he brings so much to this world. And so that's all we're asking for is some protections there for these little folks that can't speak for themselves yet. And if we had listened to that test, there were about 10 other people in our community that had the same diagnosis, and their children don't have Down syndrome. They're just fine. And they were born just fine. And so we're getting some faulty results from that test. And so this protection is not only for the children, but for those parents who might have a normal child, but they've been told that they won't and advised to abort that child. And so let's think about that as well. This is a protection for those parents as well. And so I thank you for your time today. I thank you for considering this very important piece of legislation. And I trust you to do your good work on the bill.
Questions for Senator Steinmetz? Great, thanks very much. Representative Jennings, go ahead and we'll let you. We'll mark you down in such a way.
Madam Chairman, I'll be very
Representative
brief.
Jennings.
Committee, I appreciate your time this morning taking this up. I'm co-sponsor on this, as you can see, and for the same reasons as the senator, good senator, I'm very much in support. I am, in the interest of time for the rest of them, I will express my support of all of them. I think this is the place to go. I think it's a natural place to look at this. And just as Senator Steinmetz said, there's children that get misdiagnosed. We should extend those human rights. So, stand for any questions, Madam Chairman.
Questions for Representative Jennings? Great, thanks very much. Okay, Donna, let in. We've got one person in or two. I can't. There's sort of a blur through the vinyl here. Ma'am?
Madam Chair, I've admitted 2. I've admitted Giovanina Anthony and Nathan Winters.
Okay, I didn't quite grasp. Ms. Anthony, is that your last name?
Yes.
And just introduce yourself for the family. Yep, we can hear you.
Okay, thank you so much, Madam Chair. My name is Giovanina Anthony. I'm an obstetrician gynecologist, and I practice in Jackson, Wyoming. And I oppose House Bill 161. There is a lot of very troubling terminology in this bill. I was very confused, especially on the list of diseases mentioned that include amelia, meromelia, albinism, and scoliosis. I have worked in the abortion and contraception space for over 30 years. I have never had a patient specifically, number one, when these diagnoses are extraordinarily rare, but I have never heard of an abortion being performed for these indications in my career. The statute also states that abortion would be prohibited except for a lethal disease. That is a very loose definition that, as a practitioner, would be very difficult to translate into practice. For example, if a baby is diagnosed with a cardiac malformation that may carry a, let's say, 50 to 60% risk of that baby not surviving, is that a lethal disease? If that baby is born prematurely, in addition to having a malformation of that nature, would that be a lethal disease? How do we counsel these patients with all of this loose terminology, which in the end takes away the decision-making process from these families? I am highly opposed to criminalizing doctors who we strive to provide ethical and evidence-based care to these patients. It is not the role of the state to tell these patients how to manage these pregnancies. It is, frankly, a violation of their rights as patients, and I would urge the legislature not to go down this road. I think this is an extremely disturbing bill from that point of view. And if the legislature did go down this road and this bill became law, I would absolutely hope that there would be some sort of an amendment that would guarantee these families all the help they will need with these special needs children, including the pregnant woman. Women who are pregnant with a baby with anomalies requires incredibly expensive interventions and assessment while pregnant. And after the baby is born, these babies can cost millions of dollars in healthcare, special education, PT, OT, surgeries, medications, you name it. And I would like to hope that the supporters of these babies in utero would not abandon those babies after they are born. And I would formally request an amendment of that nature be attached to this bill if it was passed. Thank you so much for the opportunity to talk to you all.
Questions for Dr. Anthony? For the committee, especially the new members, I will say that a person who is born with a disability is covered by Medicaid. For what that's worth. but that is there. Okay, let's see. I see Representative Nathan Winters on again.
Thank you, Madam Chairman. I'll speak very briefly. Again, my name is Nathan Winters, the Executive Director of the Family Policy Alliance of Wyoming. If enacted, this legislation would just prohibit abortionists from doing abortions if the reason is because the unborn baby has been diagnosed with a disability, such as Down syndrome. And really, that is where much of this legislation is coming from. And I know that some feel strongly that abortion is healthcare, but there are many of us who feel strongly that the killing of a child can never be healthcare. And it's for this reason that many states are proceeding with bills such as this to protect babies from culling in a situation when one sees the ultrasound. And so this is the proper role of government. And with that, Madam Chairman, I would just stop, and if there's any questions, I'd be willing to answer them or just simply move on.
Okay, questions for Mr. Winters? Thank you very much. Let me just see where we're at with time. It is 8:40. Okay, I got room for one more. Who have we got? Oh, I see Deacon Mike is up there already. Go ahead, Deacon Mike.
Thank you, Madam Chairman, members of the committee. Just want to testify in favor of this bill. And perhaps folks are wondering why the necessity for that. And to that, I would say, check the websites at your local clinics, see how very early these prenatal screenings can determine prenatal defects and what sort of quote unquote problems they advertise an ability to identify with these screenings. Today, a committee from the other chamber is considering a bill that was unanimously passed out of this committee that prohibited discrimination when considering organ donations because of one's disability. Members heard from a mother who has children with Down syndrome. Madam Chairman, this, along with the next bill you're going to be looking at, we're going to hear over and over again, once again, individual rights, and we need to trust our doctors. And obviously, that's something we support as well. But the question is, which doctors? In the past, our legislators and many of us who sit in on a lot of these testimonies have heard all kinds of unscientific euphemisms meant to dehumanize the unborn, describing them as clumps of cells or lifeless tissue, comparing the procedure to removing a bad appendix. But organs and tissue do not have Down syndrome. Living human beings do. And as this committee has already recognized, it's not right to discriminate against them simply because they happen to have a disability. And with that, I would support this bill once again on behalf of the Catholic Diocese of Cheyenne. Thank you.
Questions for Deacon Mike? Okay, thanks very much. Okay, public testimony on this bill is closed for now. Again, as I say, we will, if there's time left at the end, we will circle back. And the next bill up for our consideration is House Bill 70, Informed Consent. Representative Rodriguez-Williams, welcome to the Labor Committee. Okay, we have, there are more people desiring to testify on this one. So for this bill, we will be able to allot about 40 minutes. Go ahead, Representative Romero Martinez. And is this your first bill presented? Or I mean, sorry, wrong R letter start. He just got it. Rodriguez Williams, is this your first bill presented as well?
Yes, ma'am.
We are very nice. And as I told Representative Romero Martinez, you don't have to read us every word. You know, you can generally give us the highlights, and we'll ask questions to pin you down if we feel inadequately informed. So go ahead.
Thank you. Thank you, Madam Chairwoman and members of the committee. I introduce to you House Bill 70, Informed Consent, and ask for your favorable consideration. The purpose of my bill is to ensure that women considering abortion are provided adequate and accurate information prior to undergoing an abortion procedure. In 1992, the United States Supreme Court ruled in Planned Parenthood versus Casey that informed consent laws are constitutional. The court found that such laws reduce the risk that a woman may elect an abortion only to discover later with devastating psychological consequences that her decision was not fully informed. So my bill includes 7 criteria, which I will walk through the bill with you.
Okay.
On page 1, line 12, statute 3326-402, grounds for suspension, revocation, restriction, imposition of conditions, refusal to renew, or other disciplinary action. So this bill does not have a criminal consequence. The consequence on page 2, line 1, a board may refuse to renew and may revoke, suspend, or restrict a license, or take any other disciplinary action, including the imposition of conditions or restrictions upon a license on one of the more following grounds. Further down on page 2, Except in the case of a medical emergency, the physician performing the abortion on the patient, the referring physician, or a person designated by either physician shall, before performing an abortion, inform the patient of the following. Page 3, the nature of the proposed abortion procedure to be provided in writing, the probable gestational age and description of the development of the unborn child at the time the abortion would be performed, to be provided verbally, the opportunity to view an active ultrasound of the unborn child and to hear the heartbeat of the unborn child if the heartbeat is audible, the active ultrasound image and oscillation of fetal heart tone shall be of quality consistent with the standard medical practice. Further down, the patient shall be informed in writing of the opportunity to view an ultrasound and hear the heartbeat, the potential impacts of the abortion on the patient's mental health to be provided in writing, information on governmental services for pregnant women to be provided verbally or in writing. Page 4, risks and alternatives to abortion procedures, including risks of medication-induced abortion to be provided verbally. And the physician performing the abortion on the patient or the physician's agent shall obtain from the patient a voluntary and informed written consent that shall confirm the patient received this information prior to undergoing a procedure.
Okay. Questions for Representative Rodriguez-Williams? Representative Flitner.
Thank you, Madam Chairman, and thank you to the good bringer of the bill. I do have a question for you on page 3, Romanet 4. Do you know if the AMA presently recognizes the patient's mental health with regard to abortion, if they recognize that there's any connection to that right now?
Representative Rodriguez-Williams.
Thank you, Madam Chairman, and thank you, Representative Flitner. I can't speak on behalf of the AMA particularly, but I can speak anecdotally as a director of a pregnancy resource center in my community and tell you that there are psychological impacts that affect women. And we often refer to them as post-abortive. And in fact, there are many programs nationwide that address this very issue to promote healing for a woman that's undergone an abortion.
Mark, follow.
Thank you, Madam Chairman. And one other question too on Roman
you're okay with minerals, but seeing as we're experiencing technical difficulties, we figured we'd go ahead and hear your presentation of your bill, and then we'll
Absolutely.
kind of circle back.
Yeah, I
Just
submitted
trying to be
my,
efficient.
my vote, so yeah.
Okay, so we are now going to, we will come back for public testimony on House Bill 70. We are going to hear House Bill 134, the presentation by the sponsor.
Thank you, Madam Chairman. HB 134 is a heartbeat bill. It's a pro-life bill. We need to protect human life, and that's what the bill does. Going through the bill, this is amended language, and you're going to see this again and again. The concept is amending out viability and placing detectable fetal heartbeats. So you see that on page 2, line 11, page 2, lines 13 to 14. And then you see that definition of detectable fetal heartbeat on page 2, lines 17 through 20. Page 3, line 5 is really the meat of the bill. Viability is replaced with detectable fetal heartbeat, so no abortion will be performed at this point. Page 3, lines 20 through 21, viability replaced with the detectable heartbeat. Also on page 14, on line 14 is the same, and then the repealer on the bottom is the definition of viability because it's no longer in statute. So that is the bill.
Questions for Representative Gray? Okay, I do have a question. On page 3, the paragraph on 12 through 15 about the abortion procedure, and this is kind of a gruesome question, but my understanding is that some abortions could be performed, and I'm not sure, perhaps they stop the heartbeat first, but I know that some abortions involve, like, I guess, sucking out the contents of the brain or dismembering, in which case the heartbeat might not actually be terminated prior to some of those other actions. And I don't know enough about the kinds of abortion procedures. Maybe someone on, oh, maybe we're back online. They might hear us. Just let me make a brief announcement here so that the world knows what happened. Those of you who are listening in, we lost connectivity for a bit. So to be efficient with our time, we paused our public testimony on House Bill 70, the informed consent, and brought in Representative Gray to present House Bill 134 on the Heartbeat Protection Act. After he's done presenting, we will go back to the public testimony on 70 and then the public testimony on 134. That's what's going on. Okay, so maybe there will be someone that can speak to that, but do you know anything about that?
Yeah, Madam Chair, I am not, you know, Dr. Hallinan maybe can help a little with that. I know he said that there were a couple nuances in here he wanted to maybe flesh out a little bit, but I don't have an answer on that one.
Okay. Any more questions for Representative Gray? Okay. Well, thank you very much. So we will. So now, seeing as we're back to where we were, you can, if you need to go back to minerals or wait, whatever, that is evidently, unless you had something more you want to say about
Madam
this.
Chairman, could I do maybe one more sentence?
Yeah, certainly. I
Thank
thought you were
Madam
done.
I did want to note, I had it on the other page. Many states have adopted these, and I will get you the number. I mean, we're up to, it's approaching the 20s, I believe. So I did want to know.
Although, let me ask about that. To my knowledge, none of the state's laws have gone into effect. They're all in court. Is that the right status?
I believe they've been enjoined.
Okay. Representative Romero Martinez.
If it's okay for me to ask a question in regards to something Representative Gray mentioned in his first bill, I think I heard you say you'd be open to an amendment on the first one you presented to include community colleges. Is that correct?
Yeah, Madam Chairman, thank you.
Representative Gray.
Madam Chairman, yes, and I'd really appreciate that amendment. Thank you. That would be really appreciated.
And we'll be working the bills tonight. So, okay, no more questions for Representative Gray. Okay, very good. We'll let you can either stay here or go to minerals or go down to the egg and I, whatever you like.
I'll probably go back to minerals.
Oh, that's fine.
If there's anything, just
No, thank you very much, Representative Gray.
Thanks.
Okay, Donna, are you there?
Yes, I'm here, and I have 9 people in the Zoom waiting room. Oh, the number's going up. I have 18 people in the Zoom waiting room with their hands up. Would you like me to admit the first two?
So for those of you out in Zoom land, and I believe I just stated what happened there. Now I will take testimony on 70 and on 134, just so that we can keep our notes in order. I do want to, because most of us up here are taking notes probably on our bill or on some paper, and it's kind of hard to go back and forth. We have 1 hour. And to my recollection at the beginning, we basically had an equal number of people wishing to testify on these two bills. So if we had roughly 50, I will give, we can start putting them in. What I'm going to do is allow 1 minute, 40 seconds for each person who wants to testify, which is what we had for the earlier ones. And when I run out of time at 9:30, then we will switch to the next bill. Okay, so who's in first? And if you'll introduce yourself for our committee, please. So this is on House Bill 70.
This is Dr. Dean Bartholomew. I'm a family physician in Powell, Wyoming. I'm speaking in favor of House Bill 70. Although I do have some serious concerns about the enforceability of this piece of legislation, I do stand in support. Informed consent is at the heart of patient autonomy in our medical system. In order to be informed about a medical procedure, patient needs to learn what the current status of their condition is, what the expected outcome for the proposed procedure will be, what the potential side effects and complications could occur during the procedure, and also what the other options of treatment for the possible condition at hand. Of course, the medical condition of pregnancy, which let me remind all of us, is a normal function of the human body. And so in order for us to be informed on the condition of pregnancy, I believe that offering the pregnant woman the chance to see an ultrasound of the pregnancy so that she can be fully aware of the development of the embryo and or fetus, depending on the stage that we're talking about. For example, if a patient had lung cancer and they went to see their thoracic surgeon before removing their lung cancer, they surely would be shown a CT scan or an MRI of the location and the size of the cancer prior to removal. In the same way, a woman who is told maybe she has breast cancer would likely see an image of her mammogram, an ultrasound, or an MRI prior to surgery. So why would this be any different for an abortion? Why would we not show the pregnant woman the size and development of the embryo or fetus, including the presence of the heartbeat, if present, to give a pregnant woman all of the substantive facts?
Awesome. Dr. Bartholomew, I'm going to cut you. I've got my timer going here. Any questions for Dr. Bartholomew? Representative Flitner.
Thank you, Madam Chairman. And Dr. Bartholomew, you said you were concerned about enforcement on House Bill 70 with regard to abortion informed consent. Did I hear you correctly?
Yes, ma'am.
And could you just elaborate on that? Because presently, with regard to informed consent, is there any concern about enforcement?
Dr. Bartholomew.
Yes, ma'am. My concern here would be that, as far as I know, the government does not track the informed consent of any medical procedure. And so I wonder how this would be done for this specific procedure. How would that be reported to whom and by whom, and how that would be followed and or enforced?
So I would think that this would be the sort of issue where if a patient complained later, let's say the doctor removed my lung and he didn't tell me I would have trouble breathing afterwards, then the consent forms would be discoverable by civil action. So that would be why my suggestion, and Dr. Bartholomew, I suppose you heard that I think it would be better to have all of the consent requirements to be written rather than verbal. Do you have any thoughts on that?
Yes, Madam Chairwoman, I do agree that all of the informed consent should be written. That should be done in any medical procedure for exactly that fact, for the protection of both the patient and the doctor.
Okay, super. Any more questions for Dr. Bartholomew? Thank you so much. Thanks for taking care of all our patients up there in Powell.
You bet.
Okay, Donna, who's next?
Madam Chair, I admitted Jimmy D. Lees. Mr. Lees will have to unmute and turn on his video.
Okay, I think it's Mrs. Lees, because I think we've received some emails from Professor Lees, but
Thank you so much.
welcome. If you'll just introduce yourself for the committee, please.
Yes, I am Jimmy D. Lees, and I am a lobbyist for the Republican Women of Sheridan County. And I represent about 100 women. And our organization is also a part of the Wyoming Federation of Republican Women. And a year ago, both the Republican Women of Sheridan County and the Wyoming Federation of Republican Women both drafted a resolution, and that resolution stated that whereas the first timeless truth stated in the Wyoming Republican Party platform is that all individuals are endowed by their creator from the moment of conception to the moment of natural death with the rights of life, liberty, property, and the pursuit of happiness. Whereas the only purpose of government is to protect these rights for all, therefore it is time the Wyoming law applies these rights to the unborn. And what we agreed to do is that we would show support for legislature and legislators that protect the unborn, to vote for life, and to urge others. If we cannot protect the innocent, defenseless, unborn, who cannot speak for themselves, the most vulnerable among us, then of what value are our laws? And I wanted to put forth an idea, and that is, I graduated high school in '66. I am a child of the '60s and I graduated college at 70. And
Ms. Dees, I just need to say you've used your time, so make it a short idea.
okay, yes. And so I was very influenced by Martin Luther King and what was done for the rights of minorities, the content of their character and not the color of their skin. We marched for minority rights. We marched for women's rights. We have marched for other rights, but we're not marching for children's rights. And children's rights go clear down to children born and unborn. Our court system is based on protecting the rights of the defenseless.
Okay, I'm going to cut you off there. Does anyone have any questions for her?
Thank you so much.
Thanks so much, very much. Okay, Donna, who have we got next?
I admitted Bob Brechtel.
Okay. Brechtel. Yep. I see that even our former legislators have learned how to use Zoom. We have had a collection of them today. And while we're waiting on him, I will say that I will never say that there was how great COVID was, not ever. But we do have this very small silver lining, which is that now we even know how to work remotely in a blizzard. So, Donna, are you getting them in?
I see Mr. Brechtel is in. He will have to turn on his mic or and his video. While we're waiting, I've admitted Rebecca Franklin.
Okay. Mr. Brechtel, you need your, well, that's not you.
It's not.
No. I'll come to you next, although we're just wait, unless Mr. Brechtel doesn't show up though, then I'm going to skip him. Your mic and your camera, Mr. Brechtel. Okay, let's move on. If he manages to figure out those buttons, we'll come back to him. But I'm sorry, was it Rebecca? Frank, could you introduce yourself for the committee, please?
Thank you, Madam Chairman. My name is actually Dr. Lindsay Capron. Dr. Rebecca Franklin and I work in the same practice, and we're sort of trading the phone back and forth so we can continue to see patients.
I'm sorry, what was your last name?
Capron, C-A-P-R-O-N.
Okay, thank you. Go ahead, Dr. Capron.
I actually am very grateful for the comments of Dr. Dean Bartholomew, so I appreciate his testimony. Our concerns echo basically his exact concerns, which are both around the nuances of informed consent, which would require us to provide the full spectrum of consent process, which would include alternatives. And I completely agree that that's a great way for this bill to go. I also have concerns about enforceability. I have concerns about how much documentation physicians will have to provide in order to to prove that we had a diverse and complete conversation with the patient, one that would be able to be enforceable in hindsight. So for example, if a patient were to have great informed consent and, would unfortunately still elect to proceed with that procedure, if in fact they did regret that later, that it would be very difficult for us to defend ourselves, if we don't have a very, very well-written universal consent form, which I don't see sort of outlined in any part of this bill. And the other thing, I'm so sorry, I kind of came in after seeing a patient and was a bit unprepared. Is there a time allotment with this bill? Like, does the informed consent have to be done in a specific amount of time?
The bill itself does not state it. I would assume that normal medical practice, I mean, if you're doing a C-section or a knee replacement, whatever the typical, so I won't attempt to guide. I suppose the Board of Medicine has some thoughts on that, but we do not legislatively.
Okay.
Questions for Dr. Capron? Representative Ottman.
Madam Chairman, Dr. Capron, I was just wondering, would, you were talking about a complete consent form and packet. If this were to be, would it be possible, like doctors do with knee replacements and things like that, have the information available for a patient that they could receive ahead of their appointment?
Dr. Capron?
That would certainly be possible.
Okay.
Thank you.
Great. Very good. Thank you so much. Thanks for taking care of all of our folks up there. What
Thank you for
city
your
were you
time.
again?
I'm sorry.
That's all right. Go ahead. Thank you.
Thank you.
Donna, what happened to Mr. Brechtel?
I believe Mr. Brechtel has unmuted now.
How about photograph? I really like.
Hello, Madam Chairman. Can you hear me?
We can hear you. Do you have a camera on your computer too?
Madam Chairman,
Mr. Brechtel, go ahead. You have a minute. and 40
I'm
seconds.
having, Madam Chairman, can I just want to let you know that I strongly rise in favor of all of these bills. I don't know how long the technology is going to hold up. Madam Chairman, about a half century, we know that the Roe versus Wade decision didn't know when human life began. And this Roe, 50 years before, said that such we're trying to make really flawed and depraved. We need to re-examine and move back towards natural
Mr. Brechtel,
law.
you're cutting out, and I don't know.
Thank you, Madam Chairman. I appreciate the time, and I rise in favor of all of these.
Thank you. Feel free to send us an email if you have something further because we didn't get all of what you said. Thank you. Okay, Donna, who have we got next?
Thank you, Madam Chairman.
Thank you, Mr. Brechtel.
Madam Chair, I admitted Katie Noyes.
Okay. Ms. Noyes, are you there? If you could turn on your mic and your camera if you have one.
Can you hear me?
I can hear you. We would love to
Okay.
see you too if possible, but if not, we'll let you just go ahead. I'm giving you a minute and 40 seconds. So
Okay.
go right ahead. You just
We're working
introduce
on-
yourself for the committee.
We're working on the video. My name is Katie Noyes. I'm a family physician working in Jackson, Wyoming. I serve patients in Teton, Sublette, and Lincoln counties. I also have patients that live in Sweetwater, Fremont, and Park counties. And I've been practicing medicine in Wyoming as a family physician for over 8 years now. And I'm here to speak against this bill. The first reason being, physicians are experts at informed consent. Our training is extremely long, and we spend days talking about risks, benefits, and alternatives to any medical decision, whether it be a medication, a procedure, or surgery. So this is sort of completely sort of infringes on a medical professional's skills that are already well honed. The other reason is that we already have informed consent for abortion in place. So currently in our office, our informed consent form is 3 pages long and requires initials after each statement that talks about risks, benefits, alternatives. So bill is completely unnecessary. It's already in place. It's already being done. Women can already see an ultrasound if they would like to, okay? Second reason is no other healthcare procedure or decision has a government mandated script. So I certainly, for one, would never come into your room or your office and say, this is what you need to say to the public. This is what you need to say to each other, and dictate how that's said and what exactly is said. It's paternalistic, and it's assuming that I would know better than you do how to do your job. So I really think we need to step back and say physicians are doing their job. They're providing informed consent. They offer ultrasounds. Women are very well informed about the decision to proceed with either continuing a pregnancy, ending a pregnancy, or considering adoption. All of their choices are laid out to them, and we provide non-judgmental, scientific-based evidence to help them make that decision. And it's their choice. It's not the Wyoming legislature. And we don't need to dictate exactly what our physicians are telling their patients.
Question for Dr. Noyes.
To oppose this bill.
Questions for Dr. Noyes? Representative Ottman.
Madam Chairman.
Representative Ottman.
Dr. Noyes, thank you for your time and your testimony today. As you were talking, it sounds like as though your facility is very well organized. We've heard testimony, though, from a lot of offices, probably smaller, that don't have that expertise in this procedure. Do you think you could be beneficial in helping them to set up something that would be streamlined and efficient? Would be my first question. The second question is, do you perform these activities of abortion, the procedure, at your facility? And where are the consent forms kept, in the in the patient's file, or just as a general office? Thank you.
Dr. Noyes?
Yes. Madam Chairman, I'm happy to answer the questions. We are happy to help any office that wishes to provide informed consent counseling for patients with unintended pregnancies. Any OBGYN office, any family medicine practice that does obstetrics does this frequently. That's what we do every day, is help women either get pregnant, help women prevent pregnancy. So we're happy to help other offices. The only providers in Wyoming are here in Jackson. So there are no other offices that are providing abortions. So I'm not sure that any of that information is really welcome anywhere else in the state. The consent form is provided to the patient at their visit, and they are required to read it and sign it prior to me stepping into the room. And when we go into the room, we go through the consent form with them and talk about risks, benefits, and alternatives. That consent form is kept in their chart.
Dr. Noyes, if you have a staff person who has nothing to do, I'm sure you have a lot of I'm just joking because I worked in healthcare for a while, but I think it would be really helpful for the committee if you could possibly send us an electronic version of that, a blank one, obviously, so that, because obviously we don't know what is in it. My mailing address is sue.wilson@wyoledge.gov. SUE.Wilson with one L at WYOLEDGE.gov. leg.gov. I think if you don't mind, that would be really informative for us as we consider, what is out there. I will just say, I can think of other professions who are given scripts, and that's the Miranda warning for law enforcement folks and their chest cameras. We haven't gone yet to chest cameras on you, Dr. Noyes. So, okay, thank you so much. I guess there were no further questions. Thank you very much for Representative Romero Martinez.
Thanks for your
All right,
time.
we have one more question. Fast.
Quick question. I was just wondering, in the plethora of, is she still on?
Nope, she went.
I think she left.
Probably
It's
had a
okay.
patient calling for help. That'll happen when you're in the doctor's office.
I'm still
Donna.
here. I do have a patient waiting, but I'm still here.
It's brief. In the plethora of services you provide there in your clinic, I was wondering, do you have any of your staff certified in NAPRO technology or natural family procreative technology?
Dr. Noyes?
We're all well informed in helping women who don't want to use contraception in natural family planning. That's part of our training.
Okay. Thank you, Dr. Noyes. Thanks so much. Thanks for taking care of our folks up in Jackson area and Western Wyoming.
Yep. Thank you for your time.
Donna, who we got next?
I admitted Corinthia Harrison.
Okay, we're going to have, I think this might be the last one on this bill. Ms. Harrison.
Can you guys hear me? Good morning. Good morning, committee members. I'd like to just give a little background about myself and then the reasons why I'm opposing these bills. So I'm 33 years old. I've been a practicing licensed nurse for 12 years. My specialty is in the intensive care unit and emergency care. I've worked in Anchorage, Alaska, and I've also worked in Billings Clinic of Billings, Montana. I'm currently out of Cody, Wyoming. Today, growing up as a child in high school and through college, I used family planning services for birth control care due to the fact of finances. So I'd like to make note of that it was very a necessity while I was, having to take care of myself and trying to be a responsible person, trying not to get pregnant. And I also used the Plan B form and birth control. Now that I'm clearly older, another specific example for you guys today is, if I could stand up, I am 38 weeks pregnant today.
Congratulations. We hope you don't have to deliver until the snow goes away.
Yeah, I know. I've been blessed with a very good pregnancy. I've also been educated, and I went ahead and I did genetic testing at 9 weeks. Everything seemed to be fine at that 9 weeks, but had there been any complications or any genetic possibilities, chromosome abnormalities, I probably would have further been more genetic tested. But due to the fact that I was minimal risk, we went ahead and my husband and I chose to continue with our pregnancy. So I wanted to mention that the opportunity to genetic test can be done at 9 weeks. And with the background, you can also do it up to 12 weeks to find out more conclusive genetic testing or at 16 weeks. The other thing is I am religious, but I'm also not religious. I think that the judgment day between abortion should be between that person individually and God. It should not be mankind trying to inhibit or tell a person of what they can and cannot do. Thirdly, I think most women have no idea that they're pregnant even at 5 weeks. So to say that a fetal heartbeat, you can't have an abortion after a fetal heartbeat, is completely wrong, and it ties the choice behind, like, where you have no option and you have no choice. And I don't think that's right. So my rights and what I believe in, I want to be able to have the choice to have an abortion, especially if there were medical issues further on that was going to inhibit, the child's development stage and or my life. And I do believe that life is a beautiful thing. I cherish it, and it is a blessing. And I think that a woman should have the choice up to 12 weeks for that abortion choice. And anything after that.
I'm going to cut you off, but we are specifically right now hearing about House Bill 70, the informed consent. Did you have anything specific on that one? Otherwise, I need to move on.
Well, I'm sorry. Well, informed consent, I think that there's been lots of informed consent, and I agree with Dr. Noyes. testimony beforehand. There's plenty of education out there. I oppose all of these bills, and please don't tie a woman's choice behind her hands behind her back on any of these bills. And please provide education, create more funding, and don't inhibit the fact of you can't have an abortion at the term of a fetal heartbeat.
Okay, questions for Ms. Hicks? Nope, none. Thanks so much. Good luck for your next couple of weeks. Welcome to the baby.
Thank you.
Okay, thanks very much. All right, public testimony on House Bill 70 is closed for the time being unless we end up with spare time at the end. We will now open up for testimony on House Bill 134, the Heartbeat Protection Act. And just for those that were coming in a little bit late, specifically representatives who had to leave and present in other committees, what happened was we lost our technology for a bit. So to be efficient, we went ahead, took the presentation of the sponsor on this bill, and then once we had our Zoom back up again, we circled back for public comment on 70 in this one. So that's what's going on, just so you kind of wonder what's happening. Okay, so public testimony on House Bill 134, the Human Heartbeat Protection Act. Donna, who we got? Actually, let me just, do we have anyone in the room that wants to testify on this bill? We do. We'll take the seeing as I've been online for a little while now, Representative Nyman. Good morning. Welcome to the Labor Committee.
Good morning, Madam Chairman. Thank you very much for the opportunity to testify. Good morning, committee. Appreciate the opportunity. As I've sat in the back and I've listened to these different arguments pro and against the different life legislation that we're facing, I just wanted to stand and on behalf of the people of my district that I represent, that the vast majority of the folks where I come from believe and support life. And they want to see this legislation passed. They desperately want to see this come to the floor to have an open and honest debate from all sectors. So I would very much encourage all of you to please give this opportunity to all four of these pieces of legislation to do so. I guess the point that I bring into this, and to me it boils down to one very simple question. And is this what we're talking about, a human being or not? Whether you believe it is at a certain term or anything, I bring a little bit of a different perspective from the point of agriculture in my background. Some may or may not agree with my analogy right here, but the reality of it is.
Well, we did have cowbells a few years ago, so there's a link.
And I'll keep this brief. I base decisions on viability. And viability does not mean that it is able to sustain itself outside of the womb. Viability to me is the fact that if left to its own means and to come to full fruition, that it will become what it is intended to be, and that is a full human being able to be delivered. We don't terminate in our business. I don't terminate a calf at a very early age because there's a question of possibly will it be or will it not become a calf. It's a calf. It's simply at an earlier stage of development. And what we're talking about here is the ability to be able to allow that human being from the point of conception, the freedom to be able to become an adult human being is really what we boil it down to. If you salt it all the way down, the reality of it is that we're talking about is or is this not a human being? And so just to sum it up, I had to write this down because sometimes it's hard when I get into these situations, it's hard to not get emotional in it because, I mean, I'm a granddad. I've got 4 beautiful grandchildren at home, 3 granddaughters and a grandson. And it really touched my heart when Senator Steinmetz came up and talked about the beauty of a child that was born that society would say maybe was less than whole or less than perfect. Well, I believe that God desires and just says who's perfect and who isn't. And to me, all life is perfect and beautiful and independent, and it is wholly unique. And we would be at a loss if we didn't have the opportunity to have the blessing of each one of those unique individuals. But I'm pro-life because it's wrong to kill innocent human beings simply because they are unwanted, in the way, and can't defend themselves. And that to me boils it down. So with that, I appreciate the opportunity to speak to the committee. I support all of these legislations wholeheartedly, as do the vast majority of the people that I represented and voted me into this position and can then share that with you. Thank you for the
Questions for
opportunity.
Representative Nyman? Representative Connolly.
Thank you, Mr. Chairman. And I just need to say this, Representative Nyman, that I am one of those people who really do not want to be compared to a cow. I really do not. And there's going to be a lot of, I know you're laughing, but there's going to be a lot of offense out there that you just compared a woman, her uterus, the choices that she makes with a cow. Please don't do that. But I do have a question. And I would have asked it to the bringer of the bill, but I understand with what happened. I am curious about the repealer on page 3, line 23, in relation to one of the abortion bills that's going through the Senate. And I'm just curious about how that works together, because the repealer repeals the definition of viability. And so how does this bill fit in with one of the other bills? They actually are contradictory.
Yeah, could you please restate that, I guess?
And
I was trying to wrap my mind around the
as a
idea that I
co-sponsor,
compared
he may not be able to answer
ladies to
that, but-
cattle. I guess that really threw me. But anyway, go ahead.
There's a repealer in this bill on page 3 that contradicts another one of the anti-choice bills that's moving through the Senate. And so I'm curious about how these bills work together.
You mean as far as protecting life or trying to?
They don't make sense to me. And I would assume that you were putting together there's a lot of these anti-choice bills out there. And so these two don't work together.
Well, I don't have the bill in front of me to be able to lay that out. I would be better able to maybe answer that question for you. I guess what it boils down to me, Madam Chairman, Representative Connolly, I guess what it boils down to me is that I believe in the preservation of life. I mean, if that child,
Thank you, Madam Chair.
Okay,
If you don't know,
I guess I'm just trying to wrap my mind
I'm
around
going to save time for the other folks to testify. He doesn't have the bill and he doesn't have the other bill, so.
Yeah, I'm trying to answer a question. If
guess
neither
it's
one of those
probably-
pieces
we've
of
already
legislation lay in
passed the
front of me, but I
revisers
guess
bill, so.
if you're asking me, I mean, what's the correlation? It boils down to whether we want to respect the fact that that's a human life that needs to be preserved, or whether we want to say that that life doesn't have the opportunity to have the freedoms that we all enjoy.
Representative Nyman, I think the question was, and you're not going to be able to answer it, is that this bill has a repealer evidently of a term that is used in a different bill.
Oh,
So
okay.
how will it work
Very good. No.
for the other bill once you've repealed something that's in that bill? And I
okay.
don't think you can address that.
No, it's hard for
But
me to address that.
it's good that you have brought that up, and that will be an interesting question as we go forward.
Very good.
Thank you.
Okay.
Okay, anyone else in this room to testify on this bill? Yes, sir. Mr. Winnie, known to us, come up.
There's a question
Oh,
here.
was there a question?
Yeah, I do.
I'm sorry, I didn't see you. Representative Ottman.
I'm sorry. Thank you, Madam Chairman. Representative Nyman, just to clarify in my mind, is the reason that we were talking cows because you're in agriculture and isn't
Representative Ottman, we don't need to know the answer to that question to deal with the bill. So let's,
No,
I
just
really
wanna
would
talk
like
about
other
life.
people. I'm
Okay,
sorry.
I was just going to talk about the heartbeat.
Okay, you're okay.
So is that in agriculture as well as in life with any species, is the beginning of that for the purpose of life? If there's not a heartbeat, is there life in whether it be agriculture or not? And isn't that the purpose is to be able to tell if there's going to be future life is by being able to, what we would say in agriculture is prig check, or possibly an ultrasound for a human. But that is the viability, I believe, that you were talking about, or am I mistaken?
Representative Nyman.
Madam Chairman, thank you, Representative Ottman. Yes, I mean, conception is where life begins. That's what we look for. That's where I came from. That's what all of us came from. That point where egg and sperm met is where life begins. And that conception of that viability, and if left alone and left to its own development, that develops into a full-blown living, breathing, developing stages of a human being or anything that lives. And I mean, and that's when those two items meet, and that's where the conception begins. And then at that point, life begins. And from that, life grows. And so the development of that is what I'm talking about. Thank you for that question.
Okay, thanks very much, Representative Nyman. Mr. Winnie, welcome. Welcome back.
Madam Chairman, Bill Winnie, Sublette County. Very briefly, given your time, I support all of these bills. And the reason, as I see it, is we're talking about the termination of a human life. Whether in utero or after, whatever, it's still termination of a human life. And I believe it legitimate for the state, for Wyoming, to place some kind of minimum requirements on that process. You know, you talked about paperwork with regard to informed consent and so on, but some kind of minimum set of requirements on that process, even on the medical profession, given all the great things they have done over many, many years. I believe that minimum requirements legitimate, subject to your questions. Thank you.
Very good. Questions for Mr. Winnie? Yep, thanks very much. Okay, Donna, who we got online?
I've admitted Christina Maslak and Jill Cook.
Okie doke. Ms. Maslak, welcome. If you'll just introduce yourself for the committee, that would be great.
Okay. Hi, my name is Christina Maslak. I'm 14 years old and I live in Cody. Thank you, Madam Chairwoman and members of the committee. I understand that people act out of fear and rush to try to solve their problems and make rash decisions to snuff out the life of their very own babies, which cannot be undone. Every child deserves a chance at life, no matter what their DNA or chromosome numbers are. We are all unique and have so much to offer. Babies' hearts begin beating at 21 days after conception. Please vote to protect my fellow Wyomingites and their mothers from the tragedy of abortion.
Thank you, Ms. Maslak. Any questions for Ms. Maslak? Thank you very much for participating.
Thank you.
Okay, Donna, who was next? I'm sorry, I didn't remember.
I've admitted Jill Cook.
All right. Ms. Cook, welcome.
Thank you. Good morning. My name is Jill Cook. I'm the president of Cowboys for Life, the pro-life group at Wyoming Catholic College in Lander, Wyoming. And I represent hundreds of students and faculty and staff who are fully in support of all four of these legislations. Particularly for House Bill 134, I really wanted to emphasize the fact that it's the Human Heartbeat Protection Act, and that we're talking about a human heartbeat. We're not talking about the heartbeat of a parasite or a clump of cells or of any other thing. It's a human heartbeat. And if it's human, then it deserves the same rights as all of us. And we see ambulances driving by, and on the side, we see the signal of the heartbeat monitor, the line, going up and down. And we have CPR, cardiopulmonary resuscitation, to restart hearts. So we know that it is in the nature of healthcare to preserve heartbeats of humans. And any action which ends the heartbeat of a human is against healthcare. So because of that, because I think that healthcare should be for the sake of preserving the heartbeats of humans, I am very much in favor of House Bill 134. Thank you.
Very good. Thank you, Ms. Cook. Any questions for Ms. Cook? Thank you so much for participating. Donna, who have we got next?
Madam Chair, I admitted Anthony Jones.
All right.
Hello. Yes, my name is Anthony Jones, and I am
Sorry, I was
also.
taking notes still. Go ahead, Mr. Jones.
All right. Thank you, Madam Chairwoman. I am Anthony Jones, and I am also a student at Wyoming Catholic College, and I have been heavily involved with the college community as well as the community in Lander, speaking about life issues. And I want to express support for this bill as well. I've spoken to a lot of students here as well as students at the University of Wyoming. I have led multiple tabling events where we set up a table and it asks, when should human rights begin? And we have a timeline of fetal development, and we have sticky notes where students can put their sticky note on the place on the fetal development timeline where they begin where they believe human rights should begin. And if I could show you a picture of what those boards have looked like, the times that we've been there, I think you might be amazed to see the large majority of students, after we have conversations with them, as well as before, they incline toward putting their sticky note at the place of 21 days at 3 weeks where a heartbeat begins. So I've noticed among the people that I've talked to, students, community members as well, that there's widespread support for protecting the unborn from the moment of when a heartbeat begins at 21 days. So thank you for listening to my testimony.
Thank you, Mr. Jones. Questions for Mr. Jones? No, thanks very much.
Thank you.
Always good to see people
Madam
under
Chair?
the age of 40 testifying. Donna, who have we got next?
I've admitted Hannah Villeneuve.
Reverend Villeneuve, welcome.
Thank you, Madam Chair. Thank you, committee. I'm grateful to be able to testify with you all via Zoom this morning. I ask you to oppose House Bill 134. And I bring it as a Unitarian Universalist minister, as a mother, and as a Wyomingite. I am a mother of a 2-year-old, and my wife is pregnant again, so we are about to have the chaos increase. I had the joy, the delight of seeing the miracle of that 6-week ultrasound with our first child, of watching the clump of cells, yes, beat with a heartbeat in utero. It was amazing. And then it was amazing to hold her life in my hands when she was born. It's all amazing and miraculous. But my faith teaches that the miracle of human life and God's desire for human flourishing is more expansive than simply a desire for more babies to be born or more pregnancies to be carried to term. Right? That our call to promote human flourishing has to be inclusive and expansive and encompass the reality that people who are pregnant deserve the right to make their own choices. They deserve the right to make choices, intimate, heart-wrenching, difficult choices about their reproduction. And that this bill, this heartbeat bill, would not promote human flourishing in total, right? It would create situations where people who are pregnant with unwanted pregnancies would be forced to make impossible choices and will be more likely to seek them offline, to seek them illegally. And that will create not more human flourishing, but more human pain and anguish and frustration. And so as a mother and as a minister, I strongly urge you to not support this bill. Happy to stand for questions.
Thank you. Questions for Reverend Villeneuve? Nope. Thanks very much. Best of luck. Reverend Villeneuve, you really haven't seen chaos until you have 2 children in their snowsuits who now have to go to the bathroom.
I know. I will say earlier during this hearing, my child pooped on the floor here in the office. So I think I am.
We feel your pain.
Thank you.
Go forward and take care of it.
Thank you.
Who's next?
Madam Chair, I admitted someone by the name of Alexis.
Okay. Welcome, Alexis. Can you introduce yourself, at least in part, to our committee?
Yeah, good morning. My name is Alexis Morales-Muter. I am a stay-at-home mom, and I am joining to voice my support of all of the bills being discussed today. I would like to emphasize the importance of if we're looking at the if we're looking at the rights, if the rights of women to choose, I myself am a woman. I understand that there are definitely struggles that come with I guess adversity that comes with being a woman, and I'm also a minority. So I definitely have perspective of the different challenges that we face. However, I would like to kind of refer back to the unalienable rights for all humans that are referred to in the Declaration of Independence, the pursuit of life, liberty, and the pursuit of happiness. Again, there was a point made earlier to the human heartbeat. And again, that to me correlates. I don't see how a person with a heartbeat, just because they are not outside of the womb quite yet, I don't understand how that doesn't apply if they are in fact a human with the heartbeat indicates that they are alive. So I guess I witnessed some points that there are lack of resources, that that it takes away the choice. In all honesty, there is a lack of resources, but I believe that it's the presentation of the resources is where there is fault. I believe that there should be more, like we've talked about before, there should be more information prior to the actual act and procedure. I believe that there should be more resources available for after the fact that they do it, because let's say that they do decide and give their consent to have the abortion and go through with it. There is so much pain and anguish, and they have been touched on a little bit, but there's so much that it's associated after the fact. The aftermath, I guess, is where there is also issues. Everyone wants to focus just on the act itself of abortion or not, but in reality, it is definitely bigger than that. And if we can focus on the alternatives that we've mentioned, it doesn't have to be extreme. Extremes are always dangerous. We want to be able to represent all sides, and especially be the voice for the voiceless, speak for those who can't defend themselves quite yet, and also educate those who are in position to help those people in those positions, as well as the students who again, who need the information. Knowledge is power, and as long as we are not focused on being right, but on focusing on what is right and what is wrong. Terminating someone else's life because you just out of feelings, and because you're unhappy with the way that the pregnancy came about or how it's turning out, whether it be the gender, any of that, that's wrong. That's not exercising your rights effectively.
Ms. Morales, I'm going to cut you off there just so we can have other people in, but are there any questions?
Thank you. Thank you for your time.
Thank you so much for participating. Donna, who have we got next?
I've admitted Rebecca Franklin.
Okay. I think this is the other doctor of the doctor that we had before. Or maybe not. It seemed to me that we had Dr. Capron sharing her computer. Are you the other half of Dr. Capron?
Yeah. Good morning, Dr. Franklin. Dr. Capron's here with me. Dr. Skelva's here with me. We are some fantastic OBGYNs up in Sheridan, Wyoming. And we're just trying to be a resource for Madam Chairwoman and the rest of the committee to try and provide as much information as humanly possible about the medical side of things. Just because, unfortunately, the medical side of things isn't public. It's not something that you can see every day. It's not something that a lot of people understand, and it's kind of fraught with a lot of medical terminology that it sometimes weighs people down quite a bit. As far as this heartbeat bill, the biggest issue is the language in the bill specifically mentions when necessary to preserve a woman from imminent peril that substantially endangers her life or health according to appropriate medical judgment. A lot goes into medical judgment. There's a lot of multifactorial issues. And as much as I love being an OBGYN, there are less than 60 practicing OBGYNs in the state, and a huge chunk of Wyoming is underserved as far as maternal care is concerned. And so many miscarriages happen, so many maternal mortality events happen. And we have to engage our medical judgment in split seconds. And sometimes that's an ER doc, sometimes that's a family practice doc. Sometimes it's that ICU nurse that sees something happen with a patient that nobody even noticed that maybe she was pregnant. There are lots of situations where a physician needs to make a decision to help a woman and help potentially save her life, that it's really hard for a heartbeat bill like this to make us go, are you going to throw me in jail because of this? Am I going to lose my license because of this? I'd rather just make the phone calls to activate the massive transfusion protocol. I'd much rather get the OR ready and call the anesthesiologist. And I'd much rather spend the time doing informed consent with a patient who is in a very, very scary situation and talking about the procedure and talking about the risks and benefits. And if a woman has the wherewithal and her family has the wherewithal, and I try not to be partial in any way in that judgment. If this woman in those kind of situations wants to die, I will support that decision. I will sit next to her. I will hold her husband's hand. I will pray with them. I will call their pastor. We will do absolutely everything we can to make sure that her wishes are done. But a heartbeat bill really ties our hands and potentially may have grave unintended consequences for some of these situations that, and I love the women of Wyoming, but there's so many scary situations that nobody can even remotely understand that potentially can happen at 3 o'clock in the morning in the middle of a blizzard like Cheyenne just had, where you can't transfer someone out. You can't get them the blood and platelets that they need, where you can't save them from the septic shock that they're in unless you do something, unfortunately, potentially to a heartbeat. And a heartbeat means so many things to so many people. And we have committed our lives to saving women and saving babies and making families, that these bills are really, really scary. And 6 weeks heartbeats are really, really a bad place to put a cutoff. We want to help these women. We want to help these babies. We want to help these families. And this is really scary legislation. These are really scary words. And these are really scary consequences. Finding physicians to work in Wyoming is hard. I choose to work in Wyoming. I chose to come here. I think of Wyoming as the most wonderful place that avoids government intervention in healthcare. Wyoming has always trusted my judgment. Wyoming has always trusted my medical expertise to care for these women and talk to these women and really encourage them to get the care that they really, truly need. And so again, I open it up to any questions that the chair people have, because I have so many things that I can tell you. I have so many situations and so many events that I can tell you about. And I'd love for you to call me anytime, Dr. Skelva, Dr. Capron, and we'd love to take any of your questions. I have so many patients that even would love to talk to you and tell you about situations in which we saved them and we saved their babies, and we worked very, very hard to get them second opinions and to make sure that they knew all of their options. And it's really, really nice not to have to consult the legislature, consult a bill to see if it's something I can do or not do. And thank you so much for listening.
Questions for Dr. Franklin? Representative Hallinan.
Thank you, Dr. Franklin. At what stage of the pregnancy is the heartbeat identified?
Dr. Franklin?
So between 3 and 6 weeks is generally accepted a heartbeat time.
I have a follow-up. I think the time when you can hear the heartbeat with a Doppler is about 6 weeks. Is that the time that this bill envisions as being the identifying time when the heartbeat is identified?
That's actually not clearly defined. If the committee would just permit me for about 5 seconds, I'll show you the difference between what you're kind of talking about and what actually happens. So between 3 and 6 weeks, yes, the heart is definitely beating, and occasionally you can auscultate it. But can you see this handheld Doppler right here?
We can.
Okay, so that usually can't detect something reliably at 6 weeks. A lot of times what you really have to do is you have to do an ultrasound, which is a lot of times called a viability ultrasound. And this is, can you see my ultrasound machine?
No.
No, sorry. Silly
Grass.
background. This is a transvaginal ultrasound probe. Can you see that?
We can see that.
And so it's quite large. And it obviously goes in, it's endocavity probe, and it goes inside the vagina and goes up next to the cervix. And it looks in the uterus. And a lot of times, even up to 6, 7, 8 weeks, especially on some patients, up to 10 weeks, you have to use that transvaginal probe to see a heartbeat. And so it's not just an outside Doppler on the tummy, which is cute and adorable, but a lot of times it's a big endocavity probe to see the heartbeat in some patients. And everybody's tummy is built differently. Everybody's uterus is built differently. Everybody's weight, size, ethnicity, tissue density is differently. And so seeing the heartbeat isn't always as easy as it sounds. And sometimes there are 2 heartbeats, and sometimes there are 3 heartbeats.
Okay, more questions for Dr. Franklin? Representative Connolly.
Thank you, Madam Chair. Dr. Franklin, thank you so much for being here. It is so clear to me how much you care about your patients and taking care of women. I was immediately a bit appalled to hear that there are only 60 OBGYNs in the entire state. And
it's a huge deficit.
Yeah, thank you, Madam
Was
Chair.
that- what's the
Yeah, I am concerned about this bill and some of the others in particular about, because of them, and it ties the hands of physicians, and especially when you have those conversations with your patients, that do you think that it's possible that this bill and others will prevent women from getting the care that they need? Because,
absolutely.
Yeah, and could
Absolutely.
you?
I think there's going to be quite a bit of fear if this comes up, that they can't come see me, that they can't talk about their options anymore, that no one will even breathe a whisper of what can and can't be done, and almost like a gag order. There's so many amazing life-preserving options. There's lots of amazing additional testing that can be done. There's lots of specialists that can be consulted. And not having the access to early care really leads to disastrous outcomes, both mentally, physically, emotionally, and potentially life-threatening for the baby going forward, that really potentially could be preventable.
More questions for Dr. Franklin? Representative Romero Martinez.
Quick question. I asked this to another doctor earlier. I know you did mention that you offer an array of services, and thank you for all you do.
The answer is no. I do not perform elective abortions.
No. That's not
I
the
have
question.
had
That's
a wonderful opportunity to choose to never do that ever. And I choose to do that. Wyoming gives me the option to choose not to do that.
Dr. Franklin, that's not his question.
Oh, I'm so sorry.
Go ahead, Representative.
My question is, does your office offer as a service natural family procreative technologies, as is and has been pretty much, I see a big smile, maybe it's a yes, out of Nebraska, the doctor just to the east of us, who's a pioneer of this
Dr. Franklin?
technology?
So number one, I'm extremely Catholic, and so I know exactly what you're talking about. Just kind of like a comment earlier today, I was breastfeeding my 3rd child during most of the session this morning. So yes, I know this, I practice this, I can tell lots of my patients about it, and lots of my patients use this method.
Thank you, Dr. Franklin. It's kind of frightening to think your child may be absorbing politics with his mother's milk. Okay.
No, but he's also absorbing corona antibodies because I was
That's good.
vaccinated.
That's good. Thank you. No more questions for Dr. Franklin? Okay, then public testimony is closed. It's 9:56. We need to get upstairs. And
Thank you.
we'll take up these bills to work them later on. And the committee, if you'll just gather around me for a little bit of discussion as we go forward. But thank you, Donna, very much.